Vaginal delivery is the process of giving birth to a baby through the vagina. This process can be an incredible and empowering journey for many women. It can also be a daunting and overwhelming experience for first-time mothers. Every woman's labor and delivery experience is unique. Therefore, knowing what the typical childbirth should be is important. So in today's video, I'll be shedding some light on what to expect during a vaginal delivery. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I am a fertility physician and my channel focuses on everything women's health and fertility. So if this is the kind of content you're interested in, keep watching. Preparing for a vaginal childbirth is essential to having a smooth delivery process. One of the most essential steps to preparing for vaginal childbirth is attending childbirth classes. So depending on your country, the childbirth classes can be together with the antenatal classes, or in some countries or cities, it can be childbirth classes alone. Yes, in your antenatal classes, you still have the childbirth classes, but there are still special childbirth classes. Whichever way it is, the idea is they're all teaching you the same things. So these childbirth classes can help you and your partner prepare for labor, delivery, and even postpartum. In these classes, you will learn various breathing techniques, relaxation exercises, and coping mechanisms to maintain or manage pain during the labor process. One of the things you can also do when you're preparing for childbirth is discuss your birth plan with your healthcare provider, whether it's your doctor, your nurse, midwife, whoever is going to be taking the delivery, whether it's a person, a team. You have to discuss your birth plan. It's essential so that you can talk about your preferences for labor. Do you want pain meds? Do you want to deliver without pain meds? Yes, that's some women's preference. They want to be able to go through the delivery, the vaginal delivery, without any pain meds. So you have to discuss this with your healthcare provider so you can work together ahead of time on how to manage the whole process. If it is not your first time delivery, you can also discuss what medications were used in your last delivery, if it worked for you, if you prefer the same medications or you want something different. You have to work with your healthcare provider. The vaginal childbirth process typically involves 3 stages. The first stage, second stage, and third stage. The first stage is usually the longest of the 3 stages. It can last from several hours to a few days, during which your cervix will dilate from 0 centimeters to 10 centimeters. Contractions will usually start gradually, then they become more intense and more frequent as the cervix continues to dilate. During this stage, it is important to stay relaxed. Focus on your breathing pattern, your relaxation technique. I know it's not so easy, but just try to focus. Remember everything you were taught during the childbirth classes and try to stay hydrated. Once your cervix is dilated to 10 centimeters, it is fully dilated. Now you are in the second stage of labor. This is the stage we call the pushing stage. Now is the time to push, mama. The baby will start to move through the birth canal and then you will feel a strong urge to push. Pushing during contractions will help the baby move down the birth canal and eventually out of the vagina. The second stage of labor can last from a few minutes to a few hours and it can be physically exhausting, mama. But the end stage, the end result is worth it. The third stage of labor is when you deliver the placenta. The placenta is the organ that nourished your baby throughout the pregnancy. This organ, this placenta, will now detach from the uterus, that is your womb, and then come out of the vagina with a few more contractions. Now let's talk about how you can manage the labor pain. Because pain is a natural part of the childbirth process and it can be very intense and overwhelming. But there are certain pain management techniques that can help you manage your pain, that can help you cope with your pain during the labor process. Some of the pain management techniques include some of the things I've mentioned earlier. Breathing techniques, relaxation exercises. Some women prefer massages during this labor process. Some women prefer to walk to and fro, back and forth. Walking helps to reduce the pain for them, to alleviate the pain for them. And for some women, using hot or cold compresses can help to reduce the pain during labor. And then there is epidural anesthesia. An epidural anesthesia is a medical procedure where an anesthesiologist will give you an injection in your lower back. This injection will help to numb the pain from your lower back down to your legs. So from your lower back down to your legs, you will not be feeling anything. Some women prefer epidural anesthesia because it significantly numbs the pain. So as a woman, depending on your pain threshold, it is important to discuss pain management with your healthcare provider. Have a plan before labor starts. Even though vaginal childbirth is a natural process, it can sometimes lead to complications that will require medical interventions. Some of the common complications during vaginal childbirth is prolonged labor. We say a woman's labor is prolonged if she has not delivered the baby, that is, if the baby is not born at about approximately 20 hours of regular contractions. Well, some health experts will say after 18 to 24 hours of regular contractions. Or if you're carrying twins or triplets or quadruplets and your baby is not born after 16 hours of labor. We call that prolonged labor. Prolonged labor can happen if your baby is very big and cannot move through the birth canal, or if the birth canal is too small for the baby to move through, or if the baby is in an abnormal position, because normally your baby should be head down facing your back. It can also happen if your contractions are very weak. If your labor is going very slowly, just find solace in the fact that your doctor, nurse, or midwife is there to monitor you closely and also monitor your baby to check for any problems that may go wrong during this time. Another complication is vaginal tears during delivery. This can happen when the head is too big for the vagina to stretch completely, so the tears will happen around the vaginal opening, or the head is normal size but the vagina doesn't stretch easily. Tears that involve only the skin around the vagina usually heal on its own within a few weeks. However, there are some tears that are more extensive. These ones will require treatment. Your healthcare provider will examine you immediately after the delivery to identify and repair any injuries. Umbilical cord prolapse is another complication that can occur just before delivery or during delivery. It happens when the umbilical cord comes out of your cervix before your baby comes out. In a typical delivery, your baby is supposed to come out first before the umbilical cord. But when the reverse is the case, it's called umbilical cord prolapse. So in umbilical cord prolapse, as the cord comes out first before the baby, when the baby is now coming out, the cord can get squished by the baby's body and the cervix. So when this happens, it will cut off the blood supply, the oxygen to the baby, and the lack of oxygen can cause brain damage to the baby. So usually when there's a cord prolapse, immediate delivery is necessary. It is important to always have a healthcare provider during your delivery so that they can monitor both you and your baby's health during the whole process. Also, if medical intervention is necessary, your healthcare provider will be present to give immediate medical intervention. After vaginal childbirth, your body will need time to recover. You may experience some discomfort, soreness, bleeding, but these symptoms are normal and will subside with time. It is important for you to take care of yourself during this postpartum period. Get enough rest. Eat healthy, stay hydrated, and additionally, you can get support system. Your support system can include your partner, your family, friends to help you with your newborn baby. If you found this video informative and you want more content like this, subscribe to my channel, like this video, ask your questions in the comment section below, and see you in my next video.